Dr. Richard, what is meant by biomarker testing and genetic testing in regards to ovarian cancer? And what is the difference and why are they important?
So this is a great question and things that are often very confusing to patients as we talk about these. I think, if we look at these both individually, it's important to kind of to delineate the difference between the two. So biomarker testing is something that we look at that's something that is either circulated within the patient's blood or a product of the cancer diagnosis that we can look at and we can monitor very closely. These are things that are unique to each cancer patient and to each patient's cancer type. And what we're realizing, particularly with ovarian cancer, is that from one patient to another, we may see different biomarkers within that, within of what we call ovarian cancer. And these are things that are very important when we look at different treatments and different treatment options to kind of look at and follow for these patients to see how do they respond to therapy, how are they doing in the clinical setting, and what do we need to do to try to monitor and benefit them going forward. And these are things that we look at during the course of our normal care for the patients as well as during research trials. When it comes to genetic testing is something entirely different. Genetic testing is where we look at potentially a patient's inherited risk or potential inherited risk for a certain cancer subtype. And then also if they have a genetic testing that's done, if whether or not that's something that can be incorporated into the treatment for their cancer subtypes. One of the very common genetic testings that we hear about and that a lot of us have talked about in the past are BRCA or BRCA testing. BRCA testing is an inherited family genetic risk of primarily breast cancer, but also ovarian cancer, pancreatic cancers, melanomas. And these are things that we've looked at very carefully. What we see with genetic testing is that it helps us delineate a little bit better what a patient's potential risk for cancers are. And I think it's important to realize is that even if you test positive for an elevated genetic risk for cancer, your genetic testing is positive, it doesn't necessarily mean that you're going to get ovarian cancer. And so these are things that are, help us look at potential prophylactic treatment options that we may have available to the patients and things that we could do differently as far as monitoring them as we go forward, not only before they have a cancer diagnosis or even after they have a cancer diagnosis that is made.